Hi, my name is Dr. Chinasa Elue, and I'm excited to be here with you all to share with you grieving while caring, wellness strategies for caretakers in times of loss. It is an absolute joy to be here today with you for the Georgia Commission on Women Wellness Summit. And as I hop into my presentation, I would like to mention some gentle reminders for you all. I want to first encourage you, especially as we're talking about grief and loss, to be gentle with yourself. You may find some of this information to be triggering just depending on where you are professionally or personally. And so please be sure to be gentle with yourself. Take what you need from this presentation. There may be some things that may not necessarily apply to your particular context or situation, and that's okay. I'm trying to paint a more broader stroke here to really try and help support as many people as I can as I share information today. I want to encourage you to give yourself space and grace as we have this conversation today. Again, when we talk about grief and loss, it's seen as a taboo topic. We often don't want to talk about it, but the unfortunate thing is that at some point or another in our lives, we will walk through some form of grief. And so it's important for us to remind ourselves to give ourselves the space and grace we might need if we're currently navigating some grief or we find that it's triggering us in other ways. And then last but not least, I want to encourage you to show up where you are, depending on how things are unfolding for you right now. Just continue to give yourself grace as we have this dialogue today. Now, I would love to introduce myself to you a little bit further before I hop in. Again, my name is Dr. Chinasa Elue. I'm a professor of educational leadership and higher education. I'm also a grief and leadership strategist. I have been doing grief related work for the past 5 or so years. And when I think about this work, honestly, it has been really fulfilling to really have purposeful conversations on how to support other professionals and individuals as they're navigating various forms of loss. And then from a leadership standpoint, to really help leaders to begin to think about how do you systematically provide systems of support for those that you lead and serve to help them navigate difficult situations, especially in contexts where they're navigating grief or loss as well. I am a mental health advocate through and through. I really believe that we are at our best selves when we're not just physically well, but mentally well in that context. And then last but not least, I'll mention that I am completely dedicated to equipping caregivers and healthcare leaders and professionals with the tools they need in order to navigate grief consciously. So I want to mention what this space can be as we are all here together today. This space can definitely be a grieving space. There's an opportunity as you're here today to acknowledge the emotional toll of caring for patients and experiencing frequent loss. It is not an easy feat to perhaps be in situations where you're witnessing loved ones pass away, or you're witnessing a large amount of loss unfolding in your professional context. And so, if you're noticing that you're navigating or dealing with some form of grief, this can be a grieving space for you. This can also be a compassionate space. We can extend grace to ourselves amid patient deaths and also navigating heavy workloads. This can be a courageous space. Perhaps there's an opportunity for you to allow space for emotions, even while the world expects composure or for us to have it all together. Maybe you've been yearning for a space where you can be more courageous and transparent with how you've been navigating the emotions associated with grief. This can also be an imperfect space. It can be a space where we can give ourselves permission to not always feel like we have it all together, even while we're at work. And this is just a reminder that it's okay to be human and to let your humanity shine through, especially as we're talking about grief today. And then last but not least, this can be a hopeful space. It can be a space where we lean into resilience and hope, even after difficult clinical outcomes or navigating challenging circumstances with patients or families that we are serving. And as we kick things off, there's an opportunity for us to connect our hearts, minds, and bodies and how we show up to support each other today. And so, as you're here in this space and you're listening to the information I'm sharing with you, we can connect and be aligned together as we walk through this information today. We can also provide an opportunity to hold space for ourselves as we navigate our own grief and to also continue to support each other and determine the support that we might need as we continue to move forward. And so, as I kick things off, I'm going to set the stage for why we are talking about grief today. And so, under these current times, we are not operating as business as normal. We know that, especially over the past 5 or so years, with the offset of the COVID-19 pandemic, the racial and social justice movement, the social political climate, this has added complications to how we have begun to navigate the world. We know that in this same vein, that with all of these different events unfolding, it has impacted how we are seeing ourselves as professionals be able to navigate our lived experiences within our organizations. Perhaps you're here in this moment and there have been some promises of organizational change based on some things that unfolded during COVID. Maybe there were some health concerns that arose for all of us, obviously, during that time period. But maybe there were some promises that were made to better support how you show up and are able to do your job as a working professional. And what we've noticed here in this context is that some of these promises have fallen flat. And that has led to what we have all come to know as the Great Resignation. And perhaps as you're thinking about this in your current context, maybe you've experienced some cognitive dissonance. Maybe there are some things that you were told would be offered to you as an extension of support. Maybe there's been disparate working conditions. You've been working around the clock, or perhaps you've been having a more heavier caseload, and that has significantly impacted your overall work-life balance. And you've been told that resources would be provided, or perhaps you would have additional forms of support, but you're not experiencing that or receiving that. And so you're having some cognitive dissonance here with things not being aligned. Maybe you feel a lack of psychological safety in your current context and are looking for ways to really step into a work environment that supports you in that context. And what we've noticed is that when those things aren't present, the lack of psychological safety or the working conditions we desire, that has led to increased resignations. We also know, in the same vein, that grief, trauma, and loss have begun to unfold in a myriad of different ways within our organizational context. When we think about this in this current moment in time, there have been a host of different ways that we have been engaging in this conversations around how do we continue to provide more holistic support as we're noticing our professionals struggle with navigating the grief they're experiencing, both within the workplace and the work you're doing with patients, and then beyond that in our personal lives as well. And this may also be due to the various types of loss that we're seeing unfold, whether it's the loss of loved ones, loss of colleagues who have left and transitioned to roles, and maybe you didn't get a chance to say a proper goodbye. Maybe in this same vein, you're bearing witness to a loss of patients. And again, that's impacting you both mentally and physically. We're also noticing that burnout is also attributed to what we're seeing unfold to this notion of it being not being business as normal. Perhaps this may be due to some understaffing that you're experiencing. Maybe there's a lot of maybe you're feeling overworked in that same vein, and that's contributing to some of these emotions around burnout. And that can significantly impact how you're able to, one, not only just do your job, but then also have a life that is in alignment with how you want to experience both wellness and well-being while you do your work. We know that there's COVID era trauma that's still lingering here. Maybe you're having some survivor's guilt, having lived through COVID and having witnessed what we have seen happen with patients and loved ones, and you're still here. That trauma has not gone away, and perhaps there's still a need for you to take the time to process and make the time to grieve what has occurred over these past several years, especially as we've seen the deaths of our patients unfold, and maybe that's mimicking or mirroring some of the death you've seen unfold in your family life as well. And then I'll just leave here with this final point. Maybe there's some disillusionment with the healthcare systems that are here present, and you're noticing again that there's not that what you thought you were walking into professionally may not be unfolding in the manner in which you hoped, and you're now coming up for air and recognizing that things need to shift for you personally and professionally. We're going to take some time to unpack this a little bit more. Now, as we have our conversation today, I want to give us a working definition of grief because when we think about grief, we know what that perhaps may feel like. We know the symptoms of grief from a physiological standpoint, but I have a simple definition here to help guide us. Grief is a process through which one copes with a significant loss. And when we think about that again, grief can have some physical symptoms, whether it's tears, whether it's some other associated context, maybe around anxiety, insomnia, things of that nature. But grief is an actual process that we go through that helps us to be able to cope when we have experienced the loss of something or someone that is deeply personal to us. Now, when we talk about loss, this is the state of grief when feeling deprived of someone or something of value. Now, I always like to flash the Kubler-Ross grief cycle. Again, there are many more grief cycles or frameworks to talk about grief, but this is probably perhaps the more common one that you're used to when we talk about grief and loss in this context. Now, I'll mention here that this model was derived not necessarily from individuals that um, have experienced loss but who are navigating illness. But I think it's helpful for us to have some context here, leveraging this model to help us understand how we might perhaps walk through the experience of grief. And so when we think about this, you might be experiencing some denial or anger in this vein. Maybe you're bargaining and struggling to find meaning after experiencing grief personally or witnessing it on your job. Depression tends to unfold as well when we think about how grief um, manifests itself in us physically and psychologically. And maybe there's a need for you to move towards acceptance. Now, I'll mention here with this model, it looks very, very linear. And the thing I want to highlight here is that when we're dealing with grief, grief is not necessarily linear. We don't go from denial to anger to bargaining in a very sequential manner. Grief tends to honestly look a lot more like this. When we see you see the lines here with the myriad of ways that grief can unfold. We can be lost and hurt and shocked, and it's not clean cut. At times, it's often very messy in regards to how we experience grief, and we can be experiencing many emotions at the same time. And so, if I leave you with nothing here today, I want you to remember this: that there is not a linear way to process grief. Grief unfolds in messy, non-linear ways that are oftentimes very complex and complicated, depending on who we are individually because we all process and deal with grief in our own unique ways. And so our experiences will vary. And the ways in which I experience grief and loss will drastically vary for how you experience them as well. And so as you see here, the different stages that are more expanded here in the image to my left, here on the right, your experience may mimic what we see here with the scribbly lines all over the page. Now, as I'm talking about grief, especially grief and loss, one thing I wanted to bring into this conversation was this conversation around trauma, especially as I'm talking with healthcare providers in the room. And I wanted to bring into our conversation this notion around trauma because oftentimes when we're working with other individuals, especially in a clinical sense, at times, we can be experiencing trauma based on events, experiences, or effects. And I think it's important for us to understand that trauma can unfold in a variety of different ways in our professional context. So when I'm talking about events, particularly here, events that could happen may happen from a one-off situation that happens in your context. Maybe perhaps in the same vein, multiple events or chronic conditions have been triggering for you. I mentioned earlier COVID-19 and how that impacted how we experienced the world. There was so much grief and loss during that time that perhaps bearing witness to that experience over and over again from the vantage point as a provider to your patients, as an individual to loved ones and family members, um, has produced some form of trauma within you. And the important thing to remember here in this context is that it can happen to one person or a group of people, and it can be a natural or human cause. And so we know that trauma, particularly in the vantage point of navigating the events, can happen from multiple events, a person or a group of people, or be human or naturally caused in this context. Trauma can also be caused by an experience we have, right? So how we're able to assign meaning to an event can be a direct correlation to how we have experienced trauma. This can be done subconsciously as well. And so as a provider, if you've had many experiences where you have witnessed patients passing on, or you have witnessed the passing of loved ones, that experience in and of itself can produce and continue to produce some level of trauma for you. And then when we think about the effects, this can be physical or emotional harm that's caused from just consistently navigating and being exposed to trauma. This can have lasting negative effects on how we function. Our executive functioning skills may be impacted in terms of how we're able to show up and do our job, communicate effectively with others, and even take care of ourselves because when we are experiencing trauma, it can significantly impact our mental, physical, social, emotional, and spiritual well being. Now, I wanted to highlight here some secondary trauma warning signs because I think it's important for us to understand, particularly here in this vantage point, when we're navigating trauma, how trauma shows up for us physically and psychologically. Maybe you've been experiencing some chronic fatigue or having a lack of concentration. You're not able to focus on things. You're noticing that perhaps there have been multiple events that have triggered you, and these are showing up based on your past experiences with trauma. Maybe you have an emotional detachment right now. You're not able to probably connect with others, connect with your patients, connect with your families or loved ones. Maybe you're overly exhausted. And even if you were to take a week off or go on vacation and get some rest, the type of exhaustion I'm speaking to, maybe the exhaustion of being in a space where you have witnessed a disproportionate amount of loss, and that loss has produced an overwhelming amount of grief for you. And so the exhaustion seems lingering in this context. I also want to mention here absenteeism and how that shows up for us when we're navigating trauma. We may find ourselves needing to withdraw from our day-to-day activities. Maybe you find yourself needing to take more time off from work because of the experiences you've had. Maybe you're experiencing some physical illness associated with some traumatic experiences you've had in the past. And this can also directly connect to your mental health. Maybe you're noticing a decline in your mental health due to, again, just the overexposure to traumatic events and also the unprocessing of grief and loss that may be present in your particular context. And last but not least, avoidance. Maybe quite simply, it's easier for you to avoid dealing with the emotions. But the truth is, if we don't take the time to address how trauma is showing up for us, it can continue to manifest in other areas of our lives. It might show up in your professional context in terms of how there's a lack of self-regulation with your emotions. Maybe you're not able to um, handle or engage with family members or loved ones, and you're avoiding spending time with them. Again, these are important warning signs for us to be mindful of because there may be some unprocessed or unhealed trauma we have not taken the time to deal with just yet. Now, I want to pivot back into our conversation with grief. I mentioned trauma, but as we're talking about trauma, I think it's important to mention that. But I want us to also think about how it connects to how grief shows up in our lives. At times, we see grief manifesting through our emotional responses, um, how we are able to articulate how we feel when we have experienced loss and how that shows up. There may be some physical symptoms that are showing up for us as well, maybe some insomnia, some anxiety that may be present. Maybe there's some cognitive changes. Again, I always mention this because that executive functioning piece is so crucial to how we're able to do our work every day. And maybe you're noticing that cognitively you're not able to focus as much, or you don't have the drive that you once had, and you're noticing that it's impacting how you're able to do your job. That is an important piece to mention here. Maybe perhaps there's some social behavior changes you're noticing with yourself, maybe a change in appetite, maybe you're not enjoying being around your loved ones as much. Maybe you're noticing as well the activities you once enjoyed doing, you no longer have an appetite for at this point. Perhaps when we're talking about how grief manifests in our lives, there's some spiritual and existential reflection. Maybe you're having some bigger questions come up for you because you bore witness to grief and you have questions about what next, what happens from here, what happens with our patients or our loved ones that are no longer with us. And maybe there's an intense longing and yearning for some relief for some of the emotions that come up for us when we're experiencing grief and loss. Now, as a provider, as a clinician, I think it's important here to mention that we have to be aware of grief triggers. And grief triggers are the emotions and memories associated with the loss, amplifying the grieving process. And so we may not think about triggers, but I always mention this because in the context of our professional work lives, there could be things that trigger us. Maybe there was a patient or a colleague that we were close to, and there's a death anniversary that comes up, and we remember it. That could be a triggering moment for us. Maybe during the holidays, you're triggered by seeing different types of celebrations. I know the holidays typically are a triggering moment for those who have walked through some form of loss and are looking for ways to navigate the challenges associated with not having loved ones or people they cared about being around during these important milestones and moments. Maybe there are certain locations that elicit a physiological response from you because there's grief that's there. Maybe there was a particular room that you walk by where you've experienced or witnessed someone pass away in. That can provide an emotional response. Maybe there are certain objects or specific smells or sounds that elicit particular triggers for you. We have to be aware of these things. And then also just being mindful of when we're around certain people that may be triggering. Maybe they bring up memories for us individually of people that we have been caretakers for, or even our own personal loved ones. And we find ourselves struggling with navigating how do we move forward with some of the emotional responses that we're having when we have memories associated with the loss. Of people that we hold near and dear to us. Becoming aware of our grief triggers is critical in order for us to think about what solutions or types of support might we build for ourselves to help us think about when these holidays or milestones or locations that we find ourselves in are present, what might I need to do to be able to regulate and support myself through this moment? Who might I need to access? Maybe it's a therapist or a grief coach or a counselor to help you navigate the back end if you find yourself constantly in spaces where you're triggered and you're noticing that it's impacting how you show up every day. We have to build in the support that we need so that we can intentionally heal and be able to move forward. Now, I want to mention a quick framework that I developed to help you think about how you might navigate grief in your own context. And this is what I call the ACT framework, and it stands for acknowledging, care, and truth. And I'm going to break this down for you a little bit further. When I mention acknowledging here, particularly in the context of grief and loss, the first step to healing is acknowledging that the pain exists. Now, I think this is so crucial because oftentimes when we're experiencing grief, if we don't take the time to process the very difficult emotions that are present when we're walking through loss, it's almost impossible for healing to take place. And so we cannot be in denial when we find ourselves walking through a very difficult experience. We have to acknowledge that pain is there and that we know that we need to do something in order for us to heal in the current moment that we find ourselves in. The next piece I'll mention here with the ACT framework is care, and that stands for both self and community care. Now, self-care is what we do deliberately to take care of ourselves. It's the physical, emotional, and mental, and even the spiritual health components that we're mindful of. Oftentimes, when we think about self-care, we think about the proverbial bubble bath or massage that we go out to get. But what I want to encourage us to do today, especially in the context of navigating grief, is to be mindful that yes, the massage is nice. Yes, the nice warm bath is great, but we need to continue to think about self-care as a daily practice and thinking about it beyond those two or three things that sound nice to do, right? And how do we become more intentional with deliberately taking care of ourselves? And beyond self care, it's important to think about community care. And community care is critical for us to think about how do we tap into our systems and communities of support to really allow us to pull together assets and resources and time to really help each other through some of the most challenging times we'll walk through around grief and loss. We need each other in order to be able to navigate these very challenging times, and community care is critical to providing that care we need in community with other people. Part of the framework and the last piece of it is truth, and it's honoring our lived experiences. And I always say with this framework, an important question that you must ask yourself is what do you know to be true about yourself as you are making the steps to move forward in your grief? So, when we talk about truth, how are you really doing even when it feels hard? What do you know about yourself to be true in this moment? How are you honoring your lived experience? If you're missing someone, how are you creating space to honor that person that you're missing? How are you creating space to honor your patients or your clients or colleagues that you're missing that may no longer be with you? How are you creating space to walk in the truth of the moment that is before you and being honest about what you need in real time in order for you to heal intentionally and be able to move forward in a way that honors where you are, but also carries the legacy of those that you are leaving behind. Now, I want to mention here how when we think about grief and loss, there's not just one way to experience this, right? There's a duality to how we experience life. Both things that we are experiencing can be equally true for ourselves and our clients. And I want to mention and read these points to you. You can be both resilient, but also need a break. You can have given it your all, but you also might find in this moment you need to back out. You might be independent and proud of the work you've done, but you can also acknowledge that you still need others. You can be sure, but you can also acknowledge that things have changed and it requires you to shift. You might find yourself being kind and maybe perhaps you've overextended yourself because you are a kind and giving person. And you can also have boundaries, especially when you recognize that perhaps your boundaries have been thin and it's time to reinforce them as you move ahead. You might say to yourself, others have it worse, but your pain is also valid. You did your best, but maybe you also know that you're worth more. And there are things that are happening that require that you show up more for yourself and treat yourself with more compassion and humanity, especially given the context of what you might be navigating. You can express your grief and how you're experiencing it, but it's okay to acknowledge that it's time to move on and move forward after you've taken the time to process your grief. Now, I want to leave you here with some language here. We've talked a lot about grief in this context, and as we're moving towards how to continue to move ahead, I think one piece that's critical for you as a professional and even as interpersonal context is to really have the language to support you as you're working and supporting and being in conversation with others. And so I leave you here with some terminology to really help you think about how you might continue to engage in grief related conversations with others. If you are a caretaker and you are a clinician and working with patients, it's important to recognize that anticipatory grief may show up in the work that you're doing, right? People may be mourning someone before they even pass on. They may be worried about what that life might look like without that person being present. And so it's important to understand this. And I want to mention in this last column, I mentioned duration. And I this is this I took this from the literature and I left it here, even though I do think that oftentimes when it comes to grief, it's really hard to put an end cap with what is seen as an appropriate time frame to navigate grief, because honestly, depending on who we are and depending on who was lost, um, that grief may be present for a very long time. And so I hate assigning a timestamp to say, oh, you must be over it in 3 months or 6 months or a year from now. Um, it may take you several years, and that's just the reality of it. And it's okay. Bereavement, which is the experience of a loss, right? When we've lost someone, lost a patient, lost a loved one, that is the experience or the terminology we use to describe that. We've talked about grief, and that being the internal manifestation of loss, but we also might experience mourning as well. Mourning is the public ways we grieve, the funerals, the wakes, the things that you might notice that your patients or their family members are now having to contend with when their loved ones are no longer with them. And then last but not least, understanding complicated grief and how that shows up. Again, I mentioned complicated grief here because the feature around it is that sometimes it can be abnormally long, right? But I'm troubled with this term sometimes because complicated grief, although it exists and although it's very um, present, it can be disabling. And given the fact that when we walk through grief, and again, depending on the person and how the loss even occurred, um, yes, it may be complicated, but it also may be just the physical manifestations of grief. And it can last for many years. And so these are just some things to just think about and consider when we think about some grief-related terminology that may be helpful for us to guide dialogues and conversations that we're having with each other or with those that we're serving in our professional context. Now, as I prepare to wrap up this presentation, I want to mention some things that we must continue to do. We must understand that trauma, grief, and loss can and will continue to occur. We're here in this context, we're working and supporting other individuals and community members, and this is part of our day-to-day lives. It can and will continue to occur, but we must be supportive and attentive to the ways that we can provide support to each other, provide support to those that we are serving, and also look for ways to provide support for ourselves. And we must continue to reimagine what it means to work in a constant state of uncertainty and to be nimble and flexible during these times. We have to. The current times, especially as we consider the impacts on our healthcare industry, and honestly speaking, across different industries across the board, we're walking in some unprecedented times. And so we have to remain nimble and flexible here. We have to continue to lead with integrity and authenticity and to show up and be willing to lean in even when it's hard. And I know at times it may feel difficult and challenging to be flexible when we already feel stretched too thin. But we have to continue to support ourselves so that we can do the work that we're called to do. I want to leave you here with this quote by V.S. Naipaul, who's a novelist, and it says that we are never finished with grief. It is part of the fabric of living. It is always waiting to happen. Love makes memories and life precious. The grief that comes to us is proportionate to that love and is inescapable. It is important to remember that we are honestly never finished with grief. As long as we have breath, we will always walk through or experience some form of grief or loss, and we have to normalize these experiences. Something to remember here is this: you are not just a healthcare worker or provider, you are a human being first. Let's normalize grieving in care spaces and make room for our own healing. With that being said, I want to thank you so much for your time. And I would love to stay connected. Please feel free to scan this QR code and connect with me across any of these social media platforms. I'm on LinkedIn and Instagram. I also have a TED Talk available that talks about grief conscious communication. I would love for you to hear that and learn more about how we can be more intentional about talking about grief in our day-to-day lives and normalizing these conversations and removing the cloud of secrecy around talking about grief. We can normalize these experiences because they are part of our everyday context. Thank you so much for your time, and I wish you well in your journey and in the work that you are doing in the days, weeks, and months ahead. Thank you.